Go. Okay, so to begin my assessment, I would first perform hand hygiene. I would ask my patients. I would check patient chart, then ask his name.
Delangio Welch.
I'll use that to verify he is who he is. I would then get into pulling the privacy curtain for privacy and begin my assessment. Starting with the cranial nerves, smiling would be cranial nerve number 5. Lifting the eyebrows would be cranial nerve number 7. Sticking out the tongue would be cranial nerve number 9. Saying I will be cranial nerve number 12. 10 is the rise and fall of the uvula and soft palate. 1 is smell. 8 is hearing. 2 would be the use of the Snellen chart. 3, 4, and 6 would be used for the ocular motor or the cardinal gazes. I will then move into subjective questioning, starting with the head and work my way down. Any head injuries at all?
No.
Any headaches, head pains?
No.
I'll move into the eyes, asking, do you wear glasses?
Yeah.
How long have you worn glasses?
5 years.
I would then ask about hearing. Is your hearing well? Have you got any issues hearing?
No.
Okay, great. Moving into the nose, do you have any issues with smells at all?
No.
Okay, no issues with smell. Moving into the mouth, any mouth pain, mouth sores?
No.
Abrasion, scars, trouble swallowing?
No.
Okay, I would note that the skin overall is correct for ethnicity, starting with head to toe. He's pretty bare, so I could assess that to be true. I would then move into heart sounds. Any chest pains at all?
No.
Any pain radiating to the left arm hand?
No.
Okay, great. I would ask about lung sounds. Any issues breathing?
No.
Expanding your chest at all to get a breath?
No.
Trouble with that? Difficulty breathing?
Nope.
Okay, great. I would then move into GI sounds. Have you eaten today?
Yes.
How often, or how long ago was it?
30 minutes ago.
Okay, that would also impact the sound of bowel sounds. I would then ask about peripheral movements. Any issues moving your arms left and right?
No.
Reaching out for anything?
No.
Okay. His answers are coming. His affect is correct for the situation. I would give him a Glasgow Coma scale of 15. He is alert. He knows his name. You know where you are?
Yes.
And the season?
Winter.
And where are you right now?
I'm at home.
He would know he's alert to himself, person, place, and time. He would be alertness of 3. I would assess for suicidal thoughts, though I don't believe that to be a problem. I would, I'm going to move into having him shrug his shoulders, and that'll take care of cranial nerves number 11 and also strength of the shoulders. I have him turn his head against my palm this way. There you go. And then turn against this way. Okay, great. I will then move into assessment of the head, noting that the head is circular. It is symmetrical on both sides, no lumps, bumps, or bruises. I would then palpate the scalp to also find no lumps, bumps, and bruises there. I would palpate the sides of the head, or the lymph nodes, with the preauricular, postauricular, occipital, superficial. I would have him lean his head here to get the deep cervical, and then this way for the other. Posterior cervical behind the trapezius muscles. Supraclavicular above the clavicles. The mental here, the mandibular, and then submental at the ends of the mandible. I will then move into the physical assessment of the head. I will note that the hair is symmetrical. Seems to be no patches lost, no hair loss there. I'll move into the eye assessment, noting that the eyes, the eyelids move consensually. The eyes, the sclera are white. The conjunctiva is pink on both eyes there. I would note that the eyebrows and eyelashes have hair in them. I would then begin perla, and I would first test for the reaction to light in this eye, and then check the other eye for consensual movement, and then perform that on the other side as well. And then again for the other eye. Okay, I'll then say, look at that point for me and just stare at that and look at my pen. Okay, checking for a combination. Did you follow my pen for me? No. Okay, and then I would note that the pupils are equal, and I would rate them at 3 millimeters there. I would then check the patient's ears, palpating for any pain as I'm checking, and then pulling up and back to check the insides of the ears. I would perform the push test, push, pull, and push, and then I would also perform that on the other side there, pulling the ear up and back into the ear, and then push, pull, and push the ear there. I would then have my patient check his nose. I'll palpate the nose here, check alignment of the cartilage. the frontal sinuses and the maxillary sinuses here. Then have my patient lift his head up to check the insides of the nose. Checking there and checking there. I would note that the septum is deviated. It is in there are no perforations. Also that the nose appears moist and pink. I would check the I don't know if I already did yours. I would check the mouth now. I would assess the lips, teeth, tongues, gums, uvula, tonsils, buccal mucosa, and the pharyngeal wall, and the uvula and the tonsils. Just have you say ah for me there. Okay. Okay. And I would grade the tonsils at a +1. They're very far apart. Also the teeth, gums, lips, did all that. Okay. I would then move into I think that completes the head. Oh, the neck. I would then palpate the neck and have him turn your head all the way that way from me and then back this way from me to check range of motion of the neck. I'll step behind him there, noting that the uvula is, or the trachea is midline. I'll have you swallow for me to check the thyroid. Good, good, good. I'll then move into my lung and heart assessment. First, having my patient turn around this way. I would then note that the back, he doesn't have any sense of kyphosis or any issues with his back. The skin again is correct for the color. No bumps, bruises, lesions. Just have you take a deep breath for me to test the symmetric expansion and the lungs expand together as one. I would then listen to the lungs by starting at the apexes of the lungs and working my way down. Working my way down, I would explain that the lungs terminate at T7. The scapula terminates at T7. I would go down a few to T10 to terminate the field of the lungs, across to T8 and up to T6, and I would repeat that on the other side. Could you give me a deep breath? Okay, and another. I'll actually start here. Okay. 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 There. Here. Okay. Cross to, oh no, at T7 or T10, across to T8 and up to T6. Okay, and then on the other side here, I'm like here. Okay. 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 Down to T10, across to T8, and then up to T6. Okay, great, great. I would then perform tactile frimitus. You should say 99 for me.
99.
And again.
99.
And again.
99.
Okay, great, great. That I would note that the tactile frimitus appears resonant or loudest at the top, and the vibrations dissipate as I go down. I would then percuss those same fields, starting at the apexes. Across to T8 and up to T6. And then again on the other side there, starting at the apex. There, down. Across to T8 and up to T6 there. Percussing there. I would then have the patient turn around and begin my assessment from the front. I would then note first the apical pulse. I would how much time is it? Is it to show the time? Oh, crap. The apical pulse is present. I don't know any heaves or lifts. I would note that hair is symmetrical and that there is hair growth, no lumps, bumps, or bruises on the chest area. I would then listen to the patient's lung sounds, starting with the sternal border, coming down to the second intercostal space. Take a deep breath. Okay, good. And then come down. Good. Good. And one more time for you. And then I'll perform on the other side, the sternal notch, coming again to the second intercostal space. And again. And again. And again. I would then begin or go forward to listen to the patient's heart sounds. And listening to the heart sounds, I would again start at the sternal notch, find the second right sternal border at the second intercostal space. Or you have to breathe. And then come across to the left sternal border. Go down to Erb's point. Go down 3 in order to listen to the mitral sounds. And then over mid-clavicular to the tricuspid sounds. And the right side was the aortic sounds, and across on the left side were the pulmonary sounds. I would then check cap refill on my patient. And cap refill appears pulse, or cap refill appears brisk in the left hand. And again in the right. I will check the pulses here. Pulses are present. Pulses are present bilaterally and graded at a +2. I would then check percussion again on the chest area. Is it still going? Alright, cool. Alright. Starting at the sternal border, coming down to the second intercostal space. And then again on the other side there. Completing percussion, I would then move into the gastrointestinal system. Here I would note that the stomach does not seem distended, not protruding rounded, showing that there is a retention of fluid, that the hair noted, the umbilicus is centered and in correct positioning for the body. I would listen at the left lower, left upper, right upper, and then the right lower quadrants, followed by listening for bruits using the V method there and there, and then listen to the aortic just off the midline using the bell. But yeah. Listening in 2 places, I found that there are vowel sounds in each of the 4 quadrants. There are hyponormal vowel sounds in all 4 quadrants. I would then move into listening for bruits. First, listening to the renal arteries. Followed by the iliac arteries. And then the aortic just off midline. Okay, with that being done, I would, no bruits noted, I would then listen, come to the carotid arteries listening for bruits and also palpating them to make sure that they're there. Okay. And on both sides, carotid arteries are noted and at a grade of +1. I would now listen for bruits. And I was listening at the lower third, I'll begin at the top. And in 3 places, checking for bruits. With no bruits noted in the carotid arteries, and they're both present, I will then move into the. Oh, can you say alpha real quick? All right, and I found that with the assessing with the TMJ joint, which is there. I'll then check for temporal arteries and the temporal. And the temporal lobe, or the temporal artery at a +1 is present. I will then move into the dorsalis pedis. Okay. Which is just above the big toe. Present in the right foot, also at a +1. And checking here. Also noted a +1 there. I would also check the posterior tibialis here. Both noted bilaterally and a +1. All pulses found both bilaterally and a +1. I would then move into the neuromuscular. So I would first next feel the patient's muscles, searching for signs of atrophy. Any muscle pain as I'm checking there?
No.
Okay, no pain there. Checking the calves. Okay. No muscle pain or weakness found, or no muscle pain or atrophy in the muscles found. I'll then have you grab my hands and squeeze as tight as you can. Okay, then push, squeeze, and then push, and then pull. Okay, I'll rate the arm strength as strong. Crap, I need to grab the chair. Right back. Okay. Okay. Put your thumb in my hand, and then press down, and pull them back. Okay, I'll rate the patient's foot strength as strong. You guys just the patient's foot strength is rated as strong. I will then, leg lifts. Now, just lift your legs up. Well, both of them at the same time. Up, down, up, down. Just let me know when if it stops. Okay, you can stand up. Okay, and then moving into range of motion for me. Can you? Oh, I would passively move them there, and then you lift. Now you move this one, then I move. Same time. Okay, cool. Then can you lift your legs up like this for me? Okay, and then the other. Okay, and then move them in a circular motion like that. Okay, testing the patient's range of motion. I've already done the next range of motion. Oh, you push against my hand with your face there, and again here. Okay, great, great. I would then move into. I know what's next. What is next? I would then move into heel shin slides. So heel shin slides done. You just stand straight for me. Close your eyes. Okay. Okay, great, great. Then I would move into from there about. I would move into doing the gait. So I walk, start like walking.